Okay. Hello, everyone. So we have chapters 15, which cover musculoskeletal injuries, and also chapters 14, which is special populations. Um, I'm going to talk about chapter 15 first, over 14, because it's a little bit shorter. So we're going to talk about musculoskeletal injuries here in a second. So musculoskeletal injuries, think of injuries to the bones, tendons, ligaments, muscle. Those are the injuries we're going to talk about for the first half of this lecture. The second half of the lecture will be special populations, which will refer to more of your heart-related issues, our blood lipid profiles, high blood pressure, children, elderly, pregnancy, and all that fun stuff. So for the first half, we're going to talk about injuries to the body. And for the first 10 slides or so, it's going to be a couple overview slides of some terms and things you should commit to memory. So we're going to talk about a lot of overuse conditions. We have three common types of overuse conditions listed here, which you want to memorize. So you have your tendinitis, which refers to the tendons. So tendons, remember, are the connective tissue that connects bone to muscle. Over time, if you do repetitive movements for too long or too intense, things begin to deteriorate and inflame. We'll talk about a couple examples in about 10 slides or so, but tendinitis is just inflammation of a tendon, most common in your ball and socket joint. So think of your shoulder, elbows, knees, ankles, like that. Bursitis is inflammation of a bursa sac. So bursa sacs are sacs of fluid along different joints of the body. So these sacs help keep the particular joint cushiony and help with your range of motion and limit pain in the area. However, if it gets inflamed, that bursa sac will fill up with fluid, and fluid will flip around it. So the particular area will get super swollen up, and you'll begin to feel pain because that's inflammation and swelling will impinge the nerve endings around that particular area. So that's another common one. Again, happening mostly at those ball and socket joints. And then your fasciitis is the connective tissue on the bottom of the feet. So over time, the connective tissue on the bottom of the feet there will get overused. And again, same as your tendinitis, begin to deteriorate and get inflamed and break down. We'll talk about plantar fasciitis in more detail towards the end of this first half of the presentation. I also want to know the signs and symptoms of the inflammatory process. That is pain around the area. So if you touch the area, there's some sort of pain. It could be sharp, dull, maybe minor pain to severe pain, any type of pain. Redness, so the area does get a little more red in color. It's because more blood is going towards that area. Same with the swelling. So since there's more blood going to the area will swell up. Maybe warm in color, and then you might also get loss of function. That's because of that swelling. Won't be able to move your full range of motion. So you're going to want to know what that looks like in case your client will to have some sort of acute injury. You know what to look out for and when to stop exercise. So if something is super painful, obviously you always want to stop exercise. But if it's a post-injury, so they say they had rehab already and they're working with you for post-rehab, and there's some pain, you can definitely work through that as long as there's no severe swelling or anything like that, the acute stuff you want to avoid. Managing those type of acute injuries, you want to follow the RICE principle. So RICE stands for rest, ice, compression, and elevation. So resting just means trying to rest that area for about 2 days. Icing it a couple times a day, a few hours. 20 minutes at a time. Ice will help reduce that swelling and try to get some of that blood away from the area, and then fresh blood will come in. Compression will also help with the swelling, so you're wrapping the area to help squeeze that blood away from that area. And then elevate above the chest, so you want to have that limb above the heart. That way it helps the blood flow track back down towards the heart. Doing those will help bring in fresh blood to that particular area and kind of increase the healing process, as well as reduce swelling. And reducing that swelling will help with that, bringing back that range of motion. But with your acute injuries, if you say you have like a rolled ankle during a session, you always want to manage that in the moment and stop the exercise if needed, or walk it off type thing, where they kind of bring that range of motion back and see how it is, if it's not too bad. And of course, if it's bad enough, always refer them to greater medical help. Okay, and then last piece of this would be tissue healing process. So you want to familiar yourself with the healing process. Good link there for that. But there's 3 parts to it that you're going to have to know. So it's the inflammatory phase. That's the first part. Usually lasts a couple days. It says 6 here, sometimes 3. I have an example of a superficial cut that you're probably familiar with. But the healing process can be healing process for any type of tissue, so your muscle, your tendons, ligaments, and such. But I use the superficial cut because that's most of us had like a paper cut before, so it's easier to recognize. But inflammatory phase is when that blood rushes in with the nutrients, and then you're clawing the area, so that's when you usually get that scab and stuff. And after that initial phase of the blood going in there and the body has clawed the area, and most of the damage is maintained, and then you move on to your second phase, usually around day 3. It can last up to 21 days, is the fibroblastic phase. That is when you bring in fibroblasts, which are little cells that repair the tissue, depending what type of injury it is. It repairs the tissue and starts making sort of like scar tissue and healing the area and closing it up. And that'll last a couple weeks. And the last phase is remodeling, which is onward after those first initial weeks. Remodeling is that scar tissue beginning to disappear and healing over time. Once you injure your body, it's never fully back to what it used to be. So you always have some sort of scar tissue or scar of some sort. But for the most part, you're able to move back to your almost regular self, depending on the severity of the injury. But that's why over time you might see you want like a scar from your superficial cut maybe begin to disappear over time, usually a couple years. And then you have muscle strains and ligament sprains. These two terms are often confused with each other. So when we think of a strain, I think of the muscle or the tendon. So a strain is usually a micro tear along those muscle or the tendon, and that can come from an acute injury like a rolled ankle. Also, a sprain refers to ligaments. So for like the ankle example, your ligaments, you have ligaments attached in the around the bones of the foot. Those might get stretched too much, or it might even tear or micro tear. That would be a sprain. So any type of ligament damage would be a sprain. Now those, sometimes you get sprains and strains with a acute injury, so they might come together, but they're classified as two different things because two different types of tissue, ligament versus the muscle. Let's see, a couple of sprains I wanted to talk about, which are the most common ones and really refer to sport-related injuries. is your ACL tear and your MCL tear right here. Your ACL is your anterior collateral ligament. So that is the ligament in the knee that's towards the front of the knee. And so when you have your foot planted, but your body is still twisting in some way, this ACL will either tear or micro tear or get overstretched and cause an injury. So that's very common in normal walks of life and also in sport where you're planning and twisting and doing all sorts of movement in a really fast passion. But you tear that and you usually need some sort of rehab or even surgery sometimes. Your MCL refers to the medial ligament here. So think of the inside of the knee. So oftentimes in sport, when you get forces from the outside legging pushing your knee knocked in towards the medial side, that MCL will either stretch, rip, or micro tear, and you'll also have to get that repaired either by rehab or surgery. So those are some common ones that ACE wants you to know, and those would be sprains because they're involving ligaments. I'm sorry, excuse me. Those will be strains because they involve tendons. Although you might injure a couple ligaments and muscle in those injuries also. You also have bone fractures, which would be more serious. You just want to know the 4 types of bone fractures. So you have your longitudinal, which would move parallel to the bone. You have oblique, which is more of a break on an angle. Transverse is your more common, so it's kind of perpendicular to bone, but there's more of a clean break. That's more common because that's from a force being pushed in or out towards the bone. And then compression would be the bone kind of getting smashed together, meeting in the middle there, and causing some breakage, or the bone is weakest. Bone fractures are very rare in the personal training, like exercise realm, but you might get someone who had a bone fracture in the last 6 months or whatever. That would be something you want to know, just because you'll have to reduce the weight and have a little bit limited range of motion and work on that area a little bit more. But you should know the different types, these 4 types of bone fractures. Obviously, you get bone fractures from high impact movements. That's probably most common, but then you also will get your older clients. So osteoporosis weakens the bones, so you might get a little more bone fractures from those people, mostly with the compression fractures with your osteoporosis clientele. We're going to talk about osteoporosis and all those osteo injuries in chapter 14, second half of this lecture. Okay, we're going to talk about the upper body injuries now. So those slides above were just kind of the overview of your common musculoskeletal injuries, but we're going to talk about more specific ones that are very common for you to see every day in most of the upper body. Okay. So first one we have is the rotator cuff injuries. So rotator cuff, that is your shoulder, or maybe you can call it shoulder girdle here. So think of your delts, so anterior, posterior delts. Then just because that's connected to your triceps and biceps and pecs, that's associated there too. But just want to note that it's rotator cuff. A lot of people say rotator cup for some reason. So if your client says rotator cuff spelled C-U-P, it's not. It's cuff, C-U-F-F. So make sure you pronounce it correctly. But your rotator cuff injuries, often you'll get these with someone who's done a lot of overweight movement incorrectly, or maybe their job involves them doing a lot of overweight movement, so that will over time kind of deteriorate the muscles of the shoulder. You'll feel a dull pain, especially in the anterior delt, so the front delt, or in that bony part of the shoulder. You'll feel dull pain when you move your hands over your head, Very common. If you do have some sort of injury, it'll be very painful to bring a hand over a head. So most of your clients that have a rotator cuff injury probably won't have severe pain. They might have that dull pain, and it's just a little impingement in the shoulder, which is nothing too bad. You might even have a little pain radiate down the back a little bit, but mostly it's in that front shoulder. And over time, it's just from overuse injuries of doing stuff overhead incorrectly, or lifting weights over the head over time. Just the muscle begins to deteriorate, and the whole area begins to have a little pain to it. Your acute injuries, if you fall on your hand and your shoulder moves in a forceful way back, you might have a little more. That would be more injury related, that we would need to see a greater medical help, get physical therapy. If you're not able to kind of do a shoulder shrug, so bring your shoulder to your ear all the way, that might be a rotator cuff injury. So if your client does have a fall and can't bring their shoulder up, definitely have them see a greater medical professional. But as far as exercise, if you have someone that have a rotator cuff post physical therapy, or they just have that impingement in the shoulder, all they need is a greater, longer warm up. So I have a couple of exercises here that are really good. The best one, I think, are doing these over under. So you take a light resistance band and you'd start with the hands around their waist, and then you bring them as far back as they can, usually about head to neck height, and then bring it back forward. You do that a few times, really opens up the shoulder real good and the back muscles. You also can do these exercises with a resistance band. You're just really pulling that band in the full range of motion to warm up that shoulder area, because a greater warm up will really help get that tissue ready for exercise. And then if you do have someone with a rotator cuff repair or post physical therapy, you'll want them to do some sort of lighter weight, and not overdo it with the real forceful moves overhead. So really reduce the weight, have a longer warm up, and wouldn't focus too much on strength. I would focus more on endurance with the people with the shoulder injuries. And over time, a couple months, you'll get less and less pain, but still do a longer warm up for good shoulder mobility. You really want to increase that range of motion. A lot of people, what they'll do is they'll not warm up their shoulders, and they'll walk straight to a bench press machine and start doing that with heavy weights, and that's where you get your shoulder injuries. So always good to get that full range of motion, and get that area nice and blood flowing through there before you start exercise. That'll help a lot. Elbow tendonitis refers to the tendons around the elbow. So your lateral epicondylitis and medial epicondylitis, epicondyles are just another word for the tendon that attaches around the bony part of the hinge joint. So that's why they call it that. But it's a tendonitis around the elbow. And you have two types. So lateral, we also call that tennis elbow, just because in your backswing of the tennis is very forceful, and over time, if you're doing that a lot and you're not doing proper warm-up or cool-downs, that tendon will get inflamed. So you get little micro tears in the tendon. Also called tennis elbow. The medial side, we also call golfer's elbow, because in golf you do a little bit of a wrist rotation, and that forceful wrist rotation over time will also deteriorate around the epicondyle on that tendon there. Now, you don't only get these from doing golf and tennis, but we just call it that because it's the most common injuries for those two sports. But you can just call it elbow tendonitis. And again, you get these through repetitive movements. So maybe it's not tennis, but you're doing a lot of exercises with those ropes in the those ropes you have for those in some facilities. Doing those a little too much might cause a little elbow tendonitis, but doing a little forceful movements around the elbow and not properly warming up or cooling down will injure yourself there. But you'll have a pain on either inside or outside of that elbow, very dull pain, nothing sharp. As far as exercise goes, you're going to avoid high repetitions. So it's those endurance moves that really aggravate those tendonitis. You also go on to do the longer warm up. So you're going to want to warm up a light weight of bicep curls and tricep extensions to warm up the muscles around the elbow. So think of the biceps, triceps, and then also a little wrist flexion and extension to warm up the forearms, because that's on the other side. So think of the muscles around the injured area and warm up that with light weight. I also like these elbow straps. So if you can buy a elbow strap and attach it to the forearm, that helps a lot with the pain in the elbow. What that does is it compresses the muscle and it pulls more on the band and less on the elbow, on the tendon there. So it makes the pain a lot less and more manageable, so you'll be able to lift more weight. You might have a little bit of grip strength issues with these people because when you're squeezing that forearm muscle, it's going to pull on that on the tendon of the elbow. So might want to use more wrist wraps also to help with the weight if you're holding like a heavy dumbbell or something, or just reduce the weight and not try to do super heavy loading on the wrist. But over time, longer warm up and stretching on those off days will definitely help. And if you can get an elbow strap, those are very beneficial for that area. Somewhat similar is carpal tunnel. It involves the same muscles. So carpal tunnel is when you have the carpal tunnel is impinged by the swelling of the wrist. So you have the carpal bones here. And then if your wrist does get swollen up, what happens is the area where the nerve endings feed to your fingers gets impinged. And so that impingement will cause loss of feeling or a tingly feeling in the thumb side of the hand there. And so those people with carpal tunnel will have reduced grip strength, and they'll have reduced sensation in their hands, so they'll be able to feel as much, and also be a little dull pain in the wrist. That happens more so with not only overuse, but your older clientele, someone who's using their wrist too much also for their daily living. Too much wrist flexion and extension over time will swell up the area and therefore impinge. Any type of swelling of the wrist will impinge that carpal tunnel, and you'll feel that tingly feeling in the hand there. As far as exercise, the biggest thing will be stretching right here. So we want to make sure you can do the full range of motion stretches. So make sure you're stretching the forearm. So just to recap, so the muscles in the hand, when you want to make a fist, so your grip, you're using mostly the muscles in your forearm. So if you squeeze your fist and feel the forearm with the other hand, you can feel those muscles contract and get bigger. And if you release the hand, you feel that the muscles loosen up in the wrist, in the forearm there. The muscles in your hand more so, they allow you to move your fingers a little bit and also fan those fingers lateral medially there. They don't do too much of the grip. It's mostly in your forearms. So you want to focus on stretching out those forearms. That will help reduce the swelling and increase that range of motion in the wrist. There's also some hand exercises you can do. This is a really good one that I found, but you can bring the hand towards the palm, squeeze the fingers towards the palm, and then kind of drag those fingers into a fist, and then do this formation on the way out, kind of make it flat, and then pushing the fingers towards the palm of the hand and bring it out. Doing that several times is really good. That'll help not only reduce the swelling, but also increase the strength in the hand and forearm. But with your clients that have carpal tunnel, you really want to be cautious of their full wrist and full wrist extension and flexion. So if you're doing exercises, stretches are okay, but if you're doing extra exercises, you want to reduce that range of motion. So work in the mid-range. And then also, same with your elbow tendonitis, you want to reduce the weight because you won't be able to have as much grip strength. So use wrist wraps or reduce the weight overall when you're gripping things like dumbbells and such. Okay. I think low back pains are our last one for lower or upper body. Low back pains are probably the most common one. So I want you to note the difference between a spinal injury and versus what low back pain is. So low back pain is a dull pain, usually in the low back, sometimes in the middle back. And that just is a result from poor body mechanics. So when you have tight hip flexors or tight hamstrings, that gives you some sort of hip tilt. It pulls on the muscles on the back, and that impinges the nerve endings in the back, and that kind of gives you that low back pain. Spinal injury would be an actual pain where you would have limited range of motion and severe pain, not be able to maybe even stand all the way up. So know the difference between actual injury and pain. Injury, obviously, you want to get more medical help. Pain you can manage by stretching. So you do a couple hip flexor stretches, hamstring stretches, and then you can find this almost in any gym. A little back stretch. This is really good because it stretches the middle to upper back and also that lower back by bringing the hips back and stretching the back muscles out. So if your low back pain clients, you might want to reduce the weight on some of the back-related exercises, especially things like deadlifting, but also your selectalized equipment if you're doing like back extensions. Reducing the weight, and then have your client really focus on stretching on the off days. So then you stretch everything around the hips and legs and the back muscles. So you really need to stretch the whole entire trunk out to help get rid of that pain. So it's really key to stretch off days. If you are doing a back workout, I would do a little bit of a back warm-up with a little bit of body weight, maybe like those Supermans or some sort of back extension, even a twisting motion with a resistance band would be good. Okay. Lower body. So we have cartilage. Don't get that confused with your ligaments. Ligaments are, you get your medial and lateral and the ACL and PCL back there. But your cartilage is, think of like your meniscus. So that is your cushiony part of the knees and other joints. It kind of cushions the muscle, or I'm sorry, cushions the bone in between other bones. So kind of like makes a little pillow so they don't rub against each other. If the bone was rubbing against bone, that'd be very painful. So it kind of adds that layer of cushion. So a lot of injuries for sport, you might get like a meniscus tear. But overuse injuries, you might get like a bulging meniscus. What that means is this meniscus isn't sitting quite right in the bone, so it's bulging out, and that bulge will impinge a nerve, and that nerve will have a little dull pain. With a bulging or tearing a meniscus, you want to get physical therapy for that. So once they're cleared for exercise, you can work with them again. But what the physical therapist will do is they'll do exercises to one, heal the meniscus, and also if it's bulging, they'll do exercises that kind of bring that meniscus back into place. But you'll feel that dull pain, might be some swelling in the area, and you can work through it a little bit and reduce the weight. Or no, I don't. Reduce the weight, and if it is a continual issue over a month or so, I would have them see a little bit more help because they'll need to get that meniscus fixed. But the Rice principle might work here for the swelling, and that might help a little bit. So that swelling might be the result of the dull pain also. So you can try doing the Rice, but definitely try and limit movements along the knee if it's like a knee or wherever the injury may be. Try rice and then seek greater help for your cartilage issues. Iliotibial band syndrome, also called IT band syndrome, is pain along the IT band. So your IT band is that muscle that attaches at the big part of the hip into the outside of the knee. So your IT band right there. And so you'll have pain in the hip or the outside of the knee. Usually it's at the hip. But you feel that tightness. You get this a lot if you're doing a lot of lateral movement or a lot of running, especially uphill running. You'll feel that pain in the outside hip. And you might even get a little bit of swelling, but more so you'll feel that dull pain on the outside of the leg there. It might even radiate all the way down, up and down, but usually it's just on the hip pointer or the knee pointer there. For exercise, you want to do some stretches. The best stretch is this one right here where you bring that leg up. You'll feel a stretch in the hamstring, but also you really want to stretch the outside of the leg right there. So you're stretching the IT band out. So you want to really do a longer warm-up and increase range of motion slowly for activity. So a couple of leg kicks back and forth before you do any type of lower body movement is key, and then stretching before exercise and definitely stretching afterward. So you really want to increase that flexibility on the outside of the leg and that hamstring there. The IT band syndrome is very manageable though. You just got to do some stretches. You'll be back within a couple of weeks or so to get that pain out of there. And then we're going to talk about a couple of pain associated around the kneecap. So your patella is what that kneecap is. So your patellofemoral pain is in the behind and upper part of the kneecap there, also known as runner's knee. So doing a lot of running, you might get a lot of pain in the behind and above the knee there. So you might get a little pain in that quad hip flexor area. You get this mostly from tight muscles. Similar to that low back pain, if you stretch everything out, you should be okay. And just a little irritated in the knees. I might want to remember another slide. No, I don't. No, do I? I do. Okay. Go this one then. So for exercise, same thing. You're going to want to compress the area. So that's when a knee brace is really come in handy for this one. Stretching the hip flexors, hamstrings, the whole entire leg. Might even want to reduce the distance you're running if you're doing a lot of running or cycling, reducing the activity just a little bit, still doing some activity. You don't want to completely remove activity. That doesn't help either. You want to just reduce the intensity and the length, so the endurance part of it. You also want to make sure you have proper footwear. So sometimes incorrect footwear might put imbalance in the muscles and then therefore pulling on the knee improperly. So proper footwear so you're not getting overpronation in the feet is key. And then, like I said, stretching, especially IT band, quadriceps, and hamstrings will help with that. So knee braces are really good. They'll help keep the knee aligned depending on which ones you get, and also help with the compression. So it reduces the swelling also. It's more of what I just said. So yeah, the body's a kinetic change. Just remember that, and so you need to stretch everything around the leg and knee there. And then rolling is also good. Let's see, and then very similar. It's called jumper's knee. Might get a lot of this with your track runners or field competition people, and then also your basketball people. People are jumping a lot. This is very similar to the patellofemoral pain, but it's got to be at the bottom part of the leg. So it's more associated with the calf muscles. So when you're running, using mostly those leg muscles, so you get more pain in the top of the knee there. For your inferior patellar tendonitis, you're going to feel more pain in the bottom because you're getting more pull on those calf muscles. So you're going to want to stretch and roll more of the calf and the anterior tibialis there. as well as everything above because everything's connected. But you'll get more pain in the bottom side of the kneecap. The management is the same as the one I just explained, the patellofemoral pain. So you want to reduce, we have more slides here, reduce weight, longer warm-up, do the more range of motion, kicking the leg before you do any type of lifts, but also reducing the intensity, so reduce endurance and length of movements. Try not to do as much explosive movements with that jumping. Settle that down for a week or two until you get that pain back, pain gone, I should say. Then stretch and foam roll everything associated with the injured area, especially in the days off. That's key. Okay, shin splints. Okay, shin splints. A lot of people think they have shin splints. It's a very common buzzword. But what happens is when you get an inflammation in the anterior tibialis. When you get inflammation in the anterior tibialis, what that does is impinges the nerve endings around the foot and ankle, and so you'll have pain in the medial and lateral side of the middle to lower part of the leg, and you also might feel a little bit in the front of the leg, which is where you get that shin splint name from. But you'll get dull pain there, and really just need to reduce the swelling of the legs. So you will need to do those Rice principles, so especially that compression and ice after activity. What's happening here is you're doing too much lower body activity, usually if running or jumping. And so if you take the proper cool down precautions, they'll help with the swelling. So say you're a runner and you're just stretching afterward, I would add icing and compression immediately after your runs to help with that shin splints. But yeah, again, it's that dull pain in the front and side of those legs there. And again, stretching. I would stretch those calf muscles out, especially because those are close to the anterior tibialis. The anterior tibialis is a very hard muscle to stretch, but if you want to bring your toes forward like you're pressing the gas on a car, stretch that a little bit. That'll help stretch out the front of the leg, but then also stretch the reverse. Bring that foot towards the head and stretch those calf muscles and roll those also. So focus more on the bottom third of the leg for those shin splints. The Rice principle is really good for this one. Okay. Ankle sprains. So we're talking ligaments here. So very common. You roll your ankle and you overstretch a ligament in the foot. You might even hear a popping or a tearing with these. Your most common one is the lateral, so that's when your foot inverts in. Very rarely is your foot going to invert out, although you might see children do that very easily, but not so much for adults. But when you do that, what happens is you stretch those ligaments, and usually don't really tear anything, usually just stretch them, and you'll need to use those Rice principles and also increase range of motion. So use those Rice principles, so especially after activity, after the injury, compress and ice it, but then you really want to focus on range of motion. So doing these different stretches and movements. I would progress from this to this though. You don't want to jump rope right after ankle injury. So stretch out using resistance band. This says a towel, but any type of stretch around the ankle, and then you're bringing that range of motion back, so you're able to fully bring that foot back towards the knee, then forward, like you're pressing the gas of the car. So that's your plantar and dorsal flexion there. And that will help make sure you do that range of motion, will help reduce the swelling. And then again, use those Rice principles. You'll get a lot of blood pulling to the area, so you'll get very red and bruised, which isn't a terrible thing. That means the body's actually healing. But as long as you are continuing to work in that range of motion and reduce the swelling, you'll be okay within a couple of weeks. Okay, Achilles tendonitis. So your Achilles is another word for the tendon that connects from the heel all the way up to the soleus, so that's their calf muscle. When that gets inflamed, especially if you're doing a lot of movements on the toes, so if you are doing activities like dancing or something that uses a lot of that dorsal flexion, plantar flexion, you'll get overuse in the Achilles. For that, you just want to stretch those out, especially the calf muscles, and then again use those Rice principles, but you'll have dull pain in that heel there. This is a very it's going to be more, it's not so much dull, it's going to be more of a sharper pain because there's a lot of nerve endings in the bottom of the foot there. So you'll get a little more pain that's not as dull, it's going to be more sharp, but you'll still feel that pain right above that heel. Focus on the calf muscle, so that the Achilles tendon attaches to that soleus, which is the most outer part of that calf muscle. So really stretch those out, roll it, and then really focus on stretches in the off days. That will really help bring back your body back to normal, reduce the pain. And then plantar fasciitis refers to inflammation in the bottom of the foot, especially around the heel. For this one, you'll get a lot more pain in the morning when everything's super tight. So if those calf muscles are super tight, it's going to be pulling on the bottom of the foot muscle there. Usually improper footwear will cause plantar fasciitis, but also too much running or overuse of everyday movement will inflame the bottom there. But for this one, you're going to want to stretch out the hamstrings and roll those calf muscles, stretch those calf muscles, and then make sure you have proper footwear. Someone that might have poor arches will need some sort of orthotics. So they need something that adds a heel a heel to them. If they have high arches also, they'll need another type of product that has low natural arch in their shoe. So proper footwear, and then also rolling and stretching those calf muscles and hamstrings will be key to reduce that pain. Okay, so I realize a lot of those injuries we just talked about all pretty much have the same regimen to bring yourself back to pain-free. So I have this little simplified training guide for you. So if you have clients that have some sort of injury, you just got to remember that the body is a kinetic chain. So if one thing is off, you got to think about what's below it, what's above it, and try to repair the area around the injured area. So think of that. So you want to strengthen areas that are around the injured area, and also stretch, especially in those off days. Foam roll when possible the injured area, so that'll help bring back. So it's massaging the muscle, so you're going to be bringing in new blood and massaging the area to get new fresh blood, new fresh nutrients to the area to help that healing process. You also want to focus on range of motion. So over time, just making sure you're able to stretch a full range of motion, and then before you increase weight, make sure you can do the movement in a full range of motion, then increase weight. And I also wanted to mention that a lot of times when your client has an injury, they think that everyone's natural instinct is to think that if they leave it alone, it'll heal over time. But actually, if you work the area in a slow progression, it will help heal that area rather than ignoring the pain at all. So say you have a pain in the knee, instead of just doing nothing with the knee, it's better to do maybe a little cycling, and then maybe a couple of bodyweight squats, and then maybe you're able to do a little more heavier squats than full-fledged barbell squats. So you're slowly progressing the area rather than ignoring it completely. If you do nothing, it will just stay in pain and inflamed and not heal correctly. So you want to make sure you're still using that particular body part, but slowly increase intensity over time. Okay. And also, if you do have any injuries, you want us to make sure that you're recording those. So most trainers record their clients' workouts in some sort of log. So you're recording the exercises. So if you do have an overuse injury, you can see how it happened, because maybe you're doing a lot of bench press once a week, and maybe that was starting to cause a little shoulder injury, so maybe you do something else. So good record keeping is really key. Also, if there's an acute injury that happened during your session, you're going to do your facilities reporting, whatever they do. For us, we have accident reports if there's some sort of injury. Make sure you have documentation of that in case something arises later. And that's pretty much it. So we're going to talk about special populations now. I'm going to continue in the documentation part here. So when you get new clients, you're going to want some sort of health history from them. That's so you know what their prior, physical activity was before they were seeing you, but also what underlining issues they may have. So that could be heart-related issues or injury related, which we kind of just talked about the common injuries. But make sure you gain some sort of health history and formal documentation. If you want an example of what we use, you can go to this link here, and that's our health history questionnaire. You see, you can see what questions I ask our new clients before we train them. But the biggest thing is you want to ask what type of medications they're using, because if you have some sort of medication that slows the heart rate or regulates the heart rate in some way, you won't be able to use your heart rate to measure the intensity they're at. So you're going to use some sort of RPE scale. So the common medications that regulate the heart rate are beta blockers, calcium channel blockers, ACE inhibitors. However, your client will probably put the brand name of their medication, not the type. So it's best to look up the medication when you get the health history. There's lots of different brands of beta blockers, so you're not gonna memorize them all. You're not a pharmacist. Just Google the name and see what it is, and you look. Oh, it's a beta blocker. That will regulate the heart rate. It slows it down. So if you see any of those, just know that it slows the heart rate down. It keeps them around somewhere between 60 and 70 beats per minute when they're exercising. So you use RPE scale. I like to use RPE scale for all my clients anyway, but it's up to you. But heart rate will not be relevant if they're on medications. So you're getting their history of their medications, and also if they've been diagnosed with high blood pressure or and the diseases we're about to talk about. ACE also talks about SOAP notes, and that just it's more for like athletic trainers is what they use to document injuries. You can use that too if you want. Just want to know what the SOAP stand for in the SOAP note. But I don't know too many personal trainers that use SOAP notes. It's more of a athletic training type thing. Okay. Cardiovascular diseases. So we're going to talk about all the cardiovascular diseases here. But I want you to recognize the signs and symptoms for some sort of heart attack or other cardiovascular disease event. So if you have a client that has cardiovascular disease and they have chest pain, which is also called angina, difficulty breathing, which also can be a dyspnea, lightheadedness, feeling or looking kind of white in the face or losing color in their face, that's pallor, or overly rapid heart rate. So any of those signs, you want to stop exercise right away and kind of cool the person down, maybe give them some water, sit them down. Don't let them get too worried about what's happening, but you want to start to bring things down. It's just their body's getting overworked, and their hearts are weak to begin with. So all these signs are mean the heart's getting overworked. You want to stop exercise and kind of cool down right there. Also train your clients to know what they look for in case they're working on their own. But if they feel any of these, they probably know something's wrong. Okay. First one we're going to talk about is coronary artery disease. I want to note before I get into all these heart-related things are very similar, so I'm going to sound very repetitive. But coronary artery disease, that is when your arteries are clean and normal, blood is able to flow nice and freely in the veins and arteries of the heart. But if you have a fatty diet or you're not very physically active, you begin to get plaque buildup in the arteries. So that will create a blockage, and that blockage can cause a heart attack if the blood flow is not sufficient enough to supply the heart with oxygen. But a lot of times this is fixed with stents in the heart and such. But if you have a client diagnosed with coronary artery disease, that means they had some sort of event typically, and they usually have a stent or something already in place. But the actual blockage is when you're diagnosed with CAD there. Symptoms for that is very similar to the heart attack events, but it would be angina and shortness of breath. That is spelled wrong. I should say heart attack, but it's complete blockage. For all these slides, I'm going to have what the condition is, but the mode, intensity, frequency, duration, and the kind of general comments. So all these slides with this chart here is what you want to commit to memory for the ACE exam. So for your CAD people, they're going to be, if you remember the ACE IFT model, they're going to be in that phase 1, maybe the beginning stages of phase 2. So if they do have someone with CAD, they probably already went through cardiac rehab of some sort, and then they're coming to you to further their training with a personal trainer. That's a very common thing. But you're really going to start low intensity with them because they just had a heart attack event or just got their cleared for exercise and all that stuff. So start very low. They could be just beginning to be able to walk efficiently again. So cardio will be key for this one. So think of duration. However, duration should be less than 30 minutes and gradual over time. Intensity, like I said, is low. So on that RPE scale, ACE likes their scale of being on a 20, but 6 to 20, they should be at 9 or 11. But that's like a 5 on the 10 scale. So that would be 50% of their max heart rate. And then you want them to be doing at least 3 to 5 days of aerobic activity. So aerobic, remember, would be getting the heart rate a little bit elevated and doing like walking or stationary bike or repetitive movements with the limbs. And then 2 days of resistance training. So resistance training would be probably mostly body weight. Your CAD people are mostly going to be low conditioned, so they'll be able to maybe stand in a chair, but then they'll need help doing bodyweight exercises. So think of resistance bands, stability balls, medicine balls, real easy stuff, functional movement. And then try to keep sessions shorter than 30 minutes. You can increase that over time. Yeah, and then be aware of medications because most likely they'll be on something that regulates the heart rate. Like I said, for all these, memorize this chart. That's really what you got to know for these. Hypertension is referred as what we call high blood pressure. So the guidelines got updated in recent years. So that's the previous guidelines. This is the new guidelines. But really, you just want to be around your systolic blood pressure around 120, diastolic around 80. A couple of causes for hypertension. You can see here, it's mostly poor life habits, but then older age, family history, and genetics are a big part of it also. So if you have longer limbs, like longer legs and arms, you might have higher blood pressure naturally. But you can see that when you have poor blood pressure, what's happening is the heart isn't able to pump blood as efficiently through the body, so the nutrients of the body is not getting effectively everywhere. So it's better to have blood pressure on 120/80 rather than something too high where it's bouncing off the walls of the heart and causing atherosclerosis. So it's causing scar tissue around the veins and arteries from the increased pressure being bounced off the walls. So that's why you want to regulate and make sure it's slow. So it's a good flow rather than a high flow of blood. But yeah, over time you get atherosclerosis, which is another heart-related issue, which we'll talk about in a second. But as far as exercise, let me see what we got here. Okay. Hypertension is very common. So they're probably going to be on one of these medications. A diuretic is also called a water pill. So what happens is it makes you have to go to the bathroom. It kind of helps discrete water from the body, so it helps decrease the blood pressure by getting rid of volume in the body. But most likely they'll be on one of the beta blockers, calcium channel blockers, ACE inhibitors to slow the heart rate. So use the RPE scale. I'll go over exercises in a second, but then you also want to avoid isometric exercises. So isometric exercises are like those static hold moves. So like a static squat hold is not good for someone with hypertension. And also you do not want for someone to hold their breath. So make sure they're breathing efficiently. Too much pressure on the heart when you breathe in lots of air, the lungs fill up with a lot of air, compress the chest cavity, and put too much pressure on the heart. So make sure they're breathing properly. Yoga and other forms of relaxation and stretching techniques are good, like Tai Chi, and recommended by ACE. And then you'll want to know this, although it's very rare that you'll be tracking your clients' blood pressure while they exercise, but you want to know for the exam that if their blood pressure rises over 250, over 115, you to immediately stop exercise. It'd be bad. It'd be really hard to get there, especially if someone's on their medication, but you should know that number there. So for the chart, you want to focus again on endurance, and then low weight training, and the weight training should be more focused on the mind body, so de-stressing and flexibility. RPE scale on a scale of 6 to 20, 9 to 13, really I'd be like a 6, no more than a 7 on that 10 scale. Try to work out every day of the week. More is better. Really just trying to get that endurance back up. So daily activity is key. Another really important thing to note is people with hypertension, you want a longer warm up and longer cool down. That'll help get the blood pressure to the right exercise blood pressure before you start doing anything that's even remotely hard for the client. So definitely do longer warm up and cool down. You can do closer to 60-minute sessions. and like I said, eliminate the isometric exercises. I also want to mention for as far as cardio, they should be doing that most days of the week. And then resistance training isn't as important, but they should be doing low reps and high repetition. So think of 12 to 18 reps would be a good rep range for them. Stroke. Okay, so stroke, two types. Ischemic is a blockage similar to like your coronary artery disease. There's a blockage, but in the blood vessels in the brain. So when something's trying to go through there, it's unable to, and that causes a seizure. Same thing with the hemodynamic. That means there's kind of a impact in the blood vessels in the brain. They pop, and then that's really, really bad. But those are your two types of usually the blockage or a little implosion there. Risk factors are, again, unhealthy activity. You can see those there. But for stroke, what happens is the way your brain operates is one side of your brain controls one half of your body, the other side of the brain kind of controls the other half as far as motor movement goes. So if you have an impingement on one side of the body, you're going to lose function on the opposite side. And so if you do have a stroke, and you'll go to a lot of physical therapy because you'll have to relearn how to do everything with your one side of the body. So they'll go through physical therapy, occupational therapy. They'll learn how to, eat and drink with their one side of their body again, and also begin to have to relearn how to walk, depending on the severity. So you'll have one side of the body is going to be super weak, and they'll be having to learn how to do that stuff. So they'll do that with the physical therapist for a really long time. But then if you have someone who did have a stroke, it's usually because of mild stroke, they'll see a personal trainer after they've been cleared for exercise. So just know that one side of their body will be underdeveloped, so they'll have a lot of weakness on one side. I also want to note for the if you have a client that might be high risk for stroke, there's also what's called FAST, is being aware of the symptoms for a stroke event. So that would be someone who is, BFAST, someone who is losing their balance, their eyes are kind of not looking correct, one side of their face begins to droop down, maybe their one arm is starting to droop down, their speech begins to get impaired. And any of those things were to happen during a session, you want to start your EMS response right away. Like I said, as far as exercise goes, you mainly relearning how to use one side of the body. I don't see too many stroke clients in the personal training world, just because it's so hard to be cleared for exercise after physical therapy. Like I said, the mild stroke that doesn't affect the body too much, like it's a very mild severity, you might get one. But if you do, you just want to focus on normal cardio and cycle, walking, things like that. Balance exercises are really good. So standing on one foot, balancing one leg, closing your eyes, balancing one leg, incorporating balance exercise is really good. And then normal resistance training is fine to regain strength where they lost it from the stroke. Light to moderate, if you do have someone that had a mild stroke, you might be able to do moderate stuff. Try to do most days of the week. ACE recommends 5. And then depending on where they're at, build up to 30 minutes, but you can go longer to 60. And then just be aware of the signs and symptoms of a stroke there. Again, these people are going to be in phase 1, maybe the beginning part of phase 2. So won't be your common client. Okay. Peripheral vascular disease, PVD, very similar to cardiovascular disease, except instead of just the heart, we're talking about the peripheral. So think of your legs and arms, where they get the blockage and improper blood flow. So what happens over time is between high blood pressure and getting that scar tissue, or a high fat diet will begin to also build up fat in the fat lipids, and that will begin to clot the muscles, or not the muscles, the veins in the arteries, and that creates a improper blood flow. So your clients of PVD will most likely be on a high blood pressure medication, and they will probably also have high cholesterol. That goes kind of hand in hand, but those are the causes. For exercise, since they have lack of blood flow to the limbs, you just want to be cautious of the type of cardio movement you're doing. So you might even see a lot of bruising on the legs and arms. That's common because they have lack of blood flow to the area. So water exercises are really good, but you might want to do some sort of cycling if they have problems with weight-bearing activity. Walking is good too if they can do it. Light resistance training is good. You really want to start off super light though, with body weight with these people, because they have lack of blood flow in the peripherals. But doing the resistance training for the legs and arms is really good because they'll help with their blood flow and increase the blood flow in the areas that are maybe impacted. So light resistance is good to help keep the body fluid again. So light to moderate, so I wouldn't go over 6 on that 10 scale. Most days a week is good, so just try and aim for 150 minutes a week with these people. And again, slowly, gradually get them to 30, and you can get these people to 60 minutes for a workout. What the heck? Start my wine. Yeah, just be sure that you're noticing everything should look normal with their feet and hands and everything like that, but you want to make sure that they're able to move in the full range of motion. And if things start to look like a paler color, so not like a red color, or something's getting a little more white or a little more in blue color, that's a bad thing. You want to avoid that area a little bit because there's lack of blood flow, and stop exercise. Yeah, keep it moderate, like I said, and light resistance training. High cholesterol, also a lipid media. So when you have elevated LDLs in the body, you begin to, that's your bad cholesterol. So you have LDL cholesterol, which is low density lipoprotein, which is sticky and sticks to the walls of the veins and arteries, but you have high density lipoprotein, which kind of is not sticky and actually helps clean away the LDL cholesterol. So good cholesterol versus bad cholesterol. But if you have the lipidemia, you usually have elevated LDLs. You can see where your total cholesterol should be. You should keep the LDLs below 100 and your total cholesterol below 200. But when you have those elevated, usually on some sort of cholesterol medication, help keep that down. is another common one. For these people, depending on the client, moderate to vigorous activity is actually better if they're able to get there. That's because HDLs, or sorry, high intensity or vigorous exercise increases your HDLs. So you can increase HDLs through diet or high intensity movement, and that will help lower those LDL, the bad cholesterol, increase the good cholesterol. So try to get them to the higher intensity if it's possible, but if they're too deconditioned, moderate to low is good. So some activity is better than none. But really just try and get their blood lipid profile back to a normal level. So below 200 here, so below 200. Okay. If people with high cholesterol, they're usually able to do more activity than the rest of the clients we kind of just described above. So if they're able to even jog, that's okay, because you want to, again, get that heart rate a little bit higher than normal. But walking, cycling, any type of movement is good, at least a couple days a week for the cardio. Resistance training, at least twice a week, aim will focus 10 to 12 reps. So again, that's a moderate to high intensity. So make sure you try to focus on the higher intensity, so get the higher in the RPE scale. Yeah, depending on the person, if they aren't able to do the high intensity stuff, moderate to low is okay, but try to get them to progress high. You get those short bouts of vigorous in, at least 5 days a week. It says begin workouts at 15 minutes. That's because if you do, we want to be able to do 15 minutes of more high intense. That would be better than doing an hour of low intense work for this type of people. But their goal is to get to 150 to 200 minutes per week. So think of endurance here. And then if they can do multiple high intensity bouts of 15-minute movement, that would be good to get to that 150. So that'd be 15 minutes of hard work 10 times a week. Yeah, try and get back to normal levels of good and bad cholesterol. Okay, diabetes is another common one. So diabetes there's two types. Do I have the two types described? No? Okay, well, we're going to talk about type 2 diabetes here. Type 1 diabetes is an autoimmune disease where you don't make insulin at all. So it's autoimmune disease, so you can't really control that. You either get that early in life, or you might even get that later in life. But we're going to focus on type 2 diabetes because that is preventable. So type 2 diabetes is what happening is you have so many insulin receptors along the waistline, or over the body, but I'm going to talk about the waistline here. So these little green things, that's your insulin receptors. And so when you put insulin into the body, so that's a hormone in the blood, your body needs so much insulin, and your insulin receptors around the waistline are responsible for only so much surface area. And so you only have so many insulin receptors. So if you increase that surface area, it's going to spread out those insulin receptors, and you don't have enough insulin receptors for that surface area. So therefore, you take some sort of medication to give yourself more uptake in insulin. So what I'm trying to say here is if you're able to decrease the waistline of your clients, they'll rely less on their diabetes medication. So it's really about the waist circumference or other growth measurements around the body. But yeah, so diet and exercise are real key for these. And again, you're talking about that waistline there. For exercise, so since these people are mostly overweight, you got to think of weight management. So you're going to want them to really focus on cardio. So you want to be at the calorie deficit at the end of the day. You can incorporate resistance training that will help them with their activities of daily living, which is key. You can focus on the reps of around 12, I would say. For your type 1 people, depends on the people, on the person. If they're an active person, they can do almost anything. But your type 2 people, I would keep it moderate to maybe below vigorous, so maybe below a 7 out of 10 scale. But if they're only able to get to a 4 or 5 out of 10 scale because they're very new to exercise and very overweight, that's fine too. Some exercise is better than none in this case. Most days of the week, so again, we're thinking about calorie deficit. So doing a cardio activity, 5 times a week, and then 2 days of resistance training would be key here. They're trying to get them back to a regular physical activity regimen. I wouldn't be too hung up on the amount of milligrams of insulin your body needs. That's not really usually asked on the ACE exam. But no, for both of these, they have a lack of insulin for the body. Both type 1 and type 2, but type 2 is preventable. Okay, metabolic syndrome is more, it's just a category of all different types of heart-related issues. Kind of already talked about. So if you have the presence of 3 or more of these that we kind of just talked about, that means they're in the category of metabolic syndrome. And that's usually resulting from being inactive and poor diet. So excessive calorie intake. So you're going to focus on weight management and becoming active again to get all these back into their normal levels. Yeah, just poor life decisions for, you want to get those new habits corrected. So it's a lot of intervention with these type of clients, or you want to get them a slow progression of back to eating healthy and back to regular activity. Okay. So if you do have some metabolic syndrome, that means they have quite a few of the, or more than 3 of the heart-related issues. So they're going to probably really decondition. So start off real slow. So that's why it says low impact. Maybe starting off by just a simple walk or sitting in a chair effectively might be hard for some of these people. They're probably most of them are in the obese category. So slow increase to physical activity. The goal is 3 to 5 days a week. I would say 2 days of cardio, maybe, and 2 days of resistance training. And you can focus on, I would say, stay closer to 12 reps. And then I would start low to moderate intensity for all those movements. Total duration should be closer to 200 to 300 minutes. So you want to focus again on weight loss and increase in physical activity and be at calorie deficit at the end of the day. Even if doing 10 minutes of work at a time is okay. So if you're only able to walk 10 minutes, the minimum should be 10 minutes. In doing that, a lot of times throughout the day, so you're getting to 300 minutes for the week, that would be a good progression. So and then maybe get to 10 minutes and then to 15, and then over time you're getting to more and more longer bouts. But again, aiming for 200, 300 minutes a week. Asthma refers to more of the lungs. This is more of a common one. Someone with asthma probably already knows they have it, and they have an inhaler. So if they do say they have asthma on their health history, just make sure that they have their inhaler handy. What do I have here? Okay. Oops. So asthma, what happens is when you, someone with asthma, they'll have when they have a triggered event, so if there's dust in the air or it's too humid or too dry, what happens is their bronchial branches get swollen up and inflamed, and it's harder for them to breathe. And so they have asthma medication, which brings their airways back to normal, so reduces that swelling is all that is. But so if you do have a client that has asthma, you're going to avoid working out in high humidity or low humidity. So if it's super cold and dry outside, I would not work outside. If it's overly humid and hot outside, I would not work out outside also. So think of the environment. Also, if they have allergies or any type of, if there's a lot of dust or debris in the air, that might aggravate their asthma also. Sometimes just really high intensity movement also aggravates the asthma. So I'd avoid very, very vigorous work, but they can still probably work at a 7 or 8 on that RPE scale. But usually they begin to hyperventilate, and then they'll need their inhaler is all. But if you can avoid the environment issues, then you should be okay. They're able to do exercise pretty fairly fine. So they should be doing the normal 5 days a week, at least doing resistance training twice, a couple days of cardio, nothing too crazy as far as the mode, intensity, frequency, and duration goes. Just want to avoid things that trigger the asthma. Cancer is another special population. Most of us know what cancer is. It's a malignant cell. And someone who has cancer, they can exercise fairly normally. Sometimes they'll have to reduce the weight depending how far along they are in their treatment. The real goal for someone who has cancer and their, as far as exercise goes, maintaining. So if they're able to maintain, especially their cardiovascular health and a little bit of strength, that will really help with the overall health and immune system. Someone who's going through chemo will have a reduced immune system. So you want to make sure that when you're working out with them, that the area they're working out in is clean. So I would even disinfect the equipment before your session with them, just to be sure. Just because if they were to get some sort of infection from the equipment, their immune system's not strong, so it could be not so good for them. But again, maintain what they have already so they can stay healthy and keep moving is key, along with that clean environment. I would recommend going light, especially at first with them. Doing weight-bearing activity is fine. Walking's usually really good. They can even jog if they can, depending on what the cancer is. If it's a bone type cancer, you would not want to do heavy weight-bearing activity. So just know what the cancer is also. But most cases, body weight and light stuff is good. Low impact, water aerobics might be good in this situation for some people. But if they can just do some sort of light cardio movement, you just want to make sure they can do something to stay active. Yeah, strength training 2 or 3 times a week. Also, you want to note for that strength training, because they have a reduced immune system, their response to the inflammatory phase is a little bit slower. So you're going to want a little more rest in between muscle groups if you do resistance training with them. But really focus on maintaining what they have already, so doing body weight stuff and making sure you do functional movement to increase those activities of daily living, and being able to function as they were before the cancer treatment is key, as long as, and keep walking and all that fun stuff. Let's see. Progression, I wouldn't really worry about. If they can do 10 minutes at first, then build up, that's good. But usually they can go 60 minutes. Depends. If they get really tired and unable, they could probably get tired a little more quickly because of the chemo again. You might want to do a little bit shorter sessions, but for the most part, you can get them to 30 to 60 minutes. Yeah. All right. Osteoporosis. Osteoporosis is the breakdown of that spongy part of the bone. So if you see this little picture here, healthy bone will be super compacted. Not so healthy bone will be a little more bigger holes, like a bigger, more spongy, I guess you could say. Osteoporosis is very common with your female clientele who are post menopause. So estrogen helps maintain a female's bone density. So once they hit menopause, they don't have as much estrogen, so they begin to deteriorate their bone density. Really, the key to limit osteoporosis is creating bone density early part in life. So it's actually said that you should start building up that bone density through resistance training in your 30s, and over next couple 20 or 30 years you'll be able to build up that bone density, and then when you hit menopause or later in life and the bones begin to deteriorate, you'll have almost like a bank buildup of bone density, so you'll deteriorate a little bit slower. But if you do have someone that has osteoporosis, a very common one for your clients who are elderly, we want not do forceful movements like jumping or plyometric movements, although your elderly clients probably won't be able to do most of those anyway. But we want to focus more so on active daily living, so be able to efficiently move. You can do higher intense movements with them though, as far as reps go. So you can do a little bit more higher strength, however that looks for that client, around the 8 rep range. And then again, not doing any type of super hard physical activity that are high impact. Also, spinal flexion and crunches and spinal rotation also might be a little bit agitating to a client, just because the bones aren't as strong. So those hard, intense twisting motions might be a little more painful for them to do. They'll feel that one. Osteoporosis might go along with a lot of people with carpal tunnel also begin to deteriorate in their muscles in the wrist also, so they create swelling. So you might get people with that carpal tunnel from earlier also. Water exercises are really good for the people with osteoporosis, just because just having that weight-bearing activity might be hard in the joints. So the water is able to make yourself almost weightless. So that helps. So a lot of group exercises in the water is really good. Other non-weight-bearing cardio movement is also good, like a cycle bike and things like that. And then intensity should help promote bone stimulation, so that'd be like a little bit higher intense, a little more on the heavier side, as long as the client can handle it. Avoid high impact. And then a couple days of weight loading exercises and a couple days of non-weight loading, weighted cardio movements like on a cycle bike or water aerobics would be good for the cardio. Okay. Arthritis is also similar to osteoporosis, but it's called osteoarthritis. Think of more of the joints, so not so much the spongy part of the bone, but instead the area outside around the bone joints there. You have osteoarthritis. You also have rheumatoid arthritis, which is more impacted around the a swollen inflammation. You don't know too much about rheumatoid arthritis. That is going to be maintained by some sort of medication, and that medication won't affect exercise too much. But osteoarthritis is something that you'll get quite a bit of. For these, it's really hard to move around the joints. So using body weight resistance bands, really slow movement, and avoid twisting. Twisting movements really grind those muscles together, so you want to avoid that, especially for the osteoarthritis. Again, the water aerobics are really good for this one. Same treatment. The goal is to do a couple exercises where you're using resistance training, but you want to focus on the cardio to be on that something like a cycle bike or in the water, something that doesn't put a lot of stress on the bones. The key is to increase range of motion, bring back activity daily living, so being able to effectively walk, sit, stand, those sort of things will be ideal for these people. More the same as your osteoporosis and arthritis. I would not want to go as intense in the strength for the resistance training. I would reduce that just because it's harder for your joints to move, and I would focus more on the 10 to 12 rep range for strength. Okay, fibromyalgia. This is more of a newer disease that's been categorized for exercise. The cause of it's kind of unknown, but someone with fibromyalgia will have is flu-like symptoms. So it could be really hard for them to exercise. Even exercising will make them feel more tired and be a little more pain. But exercise does help to an extent. So it's good to do some exercise with this disease. Because when someone exercises, they feel worse with this condition. They might shy away from exercise, but they need to do something, even if so a low to moderate intensity cardio and resistance training is recommended, believe it or not, even though they do feel a little bit worse. But it will help them maintain their health, is the key. There's not a lot to this one. You want to make sure they're aiming for 150 minutes per week. Average of 3 to 5 days per week, and keep it on the low intensity side of things. If they can just do walking or any type of cardio equipment, that's fine. And then really light resistance training, even if it's just stretching. You want, as long as they're doing some sort of activity to keep their health up, that would be the key. Chronic fatigue syndrome is just as it sounds, you're constantly tired. Also regulated with medication might help a little bit. But the key for exercise and chronic fatigue syndrome is the amount of rest in between sets. You want to increase it. So you want to make sure the work to rest ratio is 1 to 3. So if you're working out for, say, a minute straight, you want 3 minutes of rest after that. If you're doing cardio for 10 minutes straight, you're going to want 30 minutes rest in between it. So think about that way. And yeah, the focus should be around active daily living and maintaining function. You can see what type of exercises you should be doing. Yeah, work to rest is key. 150 minutes a week, it would be ideal for these people. So that's that 3 to 5 days a week, and focusing on activities of daily living. Okay, last one, I think. Nope, never mind, that last one. Low back pain, where we talked about low back pain in the earlier chapters. I'm kind of skimming it, but just make sure you know the difference between spinal injury, so sharp pain, not be able to move very well, versus a dull pain in the back. And if you do have that dull pain in the back, you just got to do proper stretches for the hip flexors, the back, and the hamstrings, and try to get yourself back to normal range of motion. Right there, same size before. Exercises related, not too much impact. Just you want to make sure you do a longer warm up if you're doing a back workout with your client and they have low back pain. Okay, weight management. This is categorized as a special population, but most of your clients will be looking to reduce their weight or improve their body composition in some way. The goal is to get to 150 minutes per week. I've been saying that a lot. That's a recommendation by all the big health agencies. That's why we say 100 minutes of activity per week. The key for weight management is to be a calorie deficit. So say naturally your metabolism burns 1,500 calories a day and you're eating 2,200 calories a day. You want to make sure you're burning at least, what math is that, 700 calories a day to maintain your weight. So you want to make sure you're at a calorie deficit. So make sure those calories are less at the end of the day, and that could be through reducing the food through diet, and then also increasing activity. It says get up to 420 minutes per week, which is a lot. But the more activity you're able to do, obviously the more weight is going to fall off. Goal is to get to 150 minutes per week. Assuming that your client is healthy, you're able to do moderate to vigorous activity, but depending if they have any other the conditions we already talked about, you want to follow those guidelines instead and do something at lower intensity and focus on those for weight management. All right, last few are the big ones. So often when we talk about special populations, we're referring to someone of a specific age or demographic. So older adults, when we think of older adults, it's considered 65 or older. So after that, you're beginning to get a risk factor for aging issues. But once you get to be a certain age, your body begins to deteriorate, so you have hormones are decreased, so you have less testosterone, less estrogen. So doing actual activities more difficult. Also with aging, you might have a lot of overuse injuries, so oftentimes someone might be focused on activity as daily living. So the key is really to be able to move efficiently, get moving again and properly at the proper range of motion. So if someone was older and they're able to effectively walk and effectively be able to bring the hands over the head and able to have a pretty decent maintained life, they're pretty happy. So you want to maintain the activities daily living and range of motion. With your older population, you want to make sure you pay attention to their underlying health conditions. So the health history is real important. So if they do have high blood pressure, a higher blood lipid profile, note that and make sure you see what kind of medications they are taking and try to help them achieve those heart-related goals also. So, lowering the blood pressure, lowering the blood lipid profile, decreasing the waistline to decrease diabetes, all that stuff we want to focus on. If you're working on an older client also, you want to focus on keeping them hydrated. You'll find that your older clients, they tend to use the restroom more frequently. So in order for them to not use the restroom more frequently, they don't like to stay as hydrated, so they don't drink as much. But when they're exercising, you want to make sure they stay hydrated. So sometimes you kind of have to force them to drink water. So that's very important. Hydration is just overall important for exercise. You also want to make sure they're doing proper breathing techniques. I mentioned this before, but when you inhale and fill the lungs up with air, it compresses the chest cavity, which also compresses the heart. So if they have an underlying heart issue, make sure they're breathing properly, or always make sure they're breathing properly, really, and avoiding that extra compression on the heart. And like I said, bring back to function. So doing functional movements, they're probably not looking to do heavy lifting with weights or doing anything crazy in the gym. They're probably just looking to increase their overall movement and be pain-free with that movement, and also achieve their health goals for the blood pressure and the diabetes and the lipid profile. So when you think of exercises, think of this picture right here, where it's stability, range of motion, flexibility, all that fun stuff. All right, so a very general guideline for your older adults. I mean, at least 5 days a week, if not every day of the week, would be key. But low impact, and trying to focus on just being able to move efficiently. That can be, non-weight bearing activity like water aerobics or that resistance bike, but it can be also walking outside or walking on a treadmill if they're able to do it. Older people have problem with balance, so a treadmill is usually better because they can hold onto the front of the treadmill as they're doing their cardio. Resistance training should be low intensity and focused on high repetition, so they want to focus on endurance. So think of 12, 15 reps, 18 sometimes. Again, focus on balance. That's just something people begin to lose over time. So focus on those balance movements. Resistance training with resistance bands, stability balls, medicine balls, body weight, whatever functional movement. Think functional. Don't think like barbell squats and Olympic movements. Not gonna work with this crowd. They can get to moderate depending on the client. Some can get to vigorous if they're conditioned enough. Really depends on what else the client has going on. Like I said, most days of the week is key. And to get the sessions up to 60 minutes, but if they're doing a minimum of 10 minutes, that's okay. And try to get them to that 150 minutes per week, if not more. There you go. Opposite of that is our youth. So really it's the primary movements that you'll be doing with your youth are going to be either for sport or for play. So if it's for play, usually it's because you're trying to get someone just to be physically active. For sport, it's because they're trying to improve on some sort of sport technique. But they can do lots of things. They can do much cardio activity. They usually have very little contradictions to exercise, so they're able to do a lot of movement. They don't have to worry about those underlying health issues that the elderly population have to worry about. They're pretty healthy. The real key thing is, though, even if it's a competitive sport, you want to make sure it's fun. So if they're training for a sport, you want to make sure the activities are still fun, just because the kids' attention span is less than adults, obviously. We'll focus on a little bit of muscle strengthening. Hypertrophy isn't really a key here, just because most children they're already growing. So more so about the key is about building strength in the muscle and also building muscle memory for sport especially. So if they're training for basketball, to train them for certain movements for that, just building that muscle memory for that particular sport is key. As they get older, they can do more complex movements such as plyometric training. But if you have someone who's maybe this age, I wouldn't do so much plyometric movements. There are more. You can do basic plyometric movements like a standing long jump or skipping one leg. But high intensity box jumps and all that stuff, I would that will come with time. Most children have difficulty with lateral movement, so a lot of that's a skill the brain is still developing for some reason is lateral movement. So being able to work on lateral movement with children is a real good technique to do. If you train if you have a group class of young youth athletes, working on lateral movement with them, they'll be able to get a hand up on the rest of the competition if they're not doing lateral movement. Like I said, they're training for mostly muscle memory and improving their endurance. So, like I said, either they're training for a sport or for play. For play would be more so to lose weight, just make sure it's fun. So that's why the NFL made the NFL Play 60, is because they should be playing 60 minutes a day. And ironically, that's what's recommended for exercise, is that they get at least 60 minutes of activity a day. So that's where that NFL Play 60 came from. But they should be doing some sort of activity for an hour a day, and they're able to do lots of different type of movement, vigorous to moderate. Just make sure they're doing proper cool down with them so they don't develop improper overuse injuries over time. As far as strength training, you can do strength training with them. Of course, it's all upon age appropriateness. So if you have someone who's a lot younger, I wouldn't have them lifting too much of the weights. But if it seems right, and you have if you have a 12-year-old that looks like the size of a 16-year-old, they can definitely be lifting weights. Some kids mature faster than others, but it's really about what you think they're ready for. And as long as you're not injuring them and they're doing everything with the proper range of motion and at the right intensity, any exercise can be really safe. I want to, did I note it up here? I guess I didn't. I did not mention it. I want to mention this is real important. Youth also have underdeveloped sweat glands. So they do not sweat as much as adults. So training them or not training them, making sure they hydrate is real important. So they're not going to sweat as much, and so they could get overheated easily. So when someone sweats, it's their body's way of cooling itself down, and so they need to be drinking lots and lots of water, just because they might get dehydrated because they don't sweat as much because they have underdeveloped sweat glands. So just make sure they're drinking properly, and also doing everything else, the exercises properly and all that fun stuff. Okay. Last one, I think. Yep. Pregnancy. Okay. You'll get a lot of clients that are pregnant, believe it or not. It's a very common thing for someone who's pregnant to be working out. It's just research has shown that if you are pregnant and work out, that yields usually healthier and sometimes larger babies. So it's really good for both mother and child to be working out during exercise. There are some precautions you want to take, though. Do not exercise if you see any of these risk factors happen. But you're going to use RPE. Like always, though, I always use RP, but you're not going to be able to use heart rate because a mother's heart rate will be elevated because of the infant, so their heart rate's not going to be as accurate. Avoid vigorous activity just because it's not necessary, and too much overly vigorous activity would be actually bad for the infant, as you put too much pressure on the womb. So starting the second trimester, really, you should avoid supine movements. So if you remember that is facing up. So this image right here, facing up. What that does is after the second trimester, your infant's getting pretty big and pushes too much pressure on this main artery that goes against the womb in the spine here. So if you put too much pressure on that artery right there, lack of blood flow going up and down to the body, might get a little lightheaded. So avoid those complete supine positions. A good position, though, is having that arch, using like a stability stability ball or some sort of arch. So they can sit up a little bit. That's fine. They can be doing that as long as they're just not completely flat 180 degrees on the ground there laying down. Being prone is okay though, so like a plank is okay. I would avoid a lot of twisting motions as you get later in the pregnancy because it's more difficult of your range of motion. Well, it's fairly safe still though. And as far as core work, I would focus more on static movements. As long as you're breathing properly, I would focus more on the things like planking, but not focusing so much on core, but working on more so functional movement that keeps the heart rate up, and not doing plyometrics, but doing movement that keeps the body moving, heart rate elevated. The key is to keep the heart rate elevated, and you move efficiently. Avoid high temperatures, just a couple of obvious things to avoid here. One of the best exercises some research has said actually is cycle classes and cardio cycle movements. It's because it being at a incline movement, if this was in a standing position, it would be a lot easier on the back and core muscles, so it's not as achy, and they're able to more efficiently move on a cycle bike as opposed to walking or bring on a tremolo or something. So I would recommend doing some sort of cycle movement for your pregnant clients. But light to moderate movement is good. You don't want to get too vigorous. I would keep it below a 7 on the RPE scale, on that 10-point scale, 9 to 13 on the 20 scale. If you can go 15 to 30 minutes, that's good. You can really get up to an hour though. And you want to do a couple times per week. If you can get at least 5 days per week, that'd be good. A little bit of strength training is good. A little bit of cardio, like I said. As long as you keep the heart rate up, that's key, is to work the cardiovascular portion of exercise. So keep the heart rate strong. And what to avoid. Definitely avoid supine movements after the first trimester, so second trimester and on. And that's it. So no, that's a lot of information. It's probably the most in-depth lecture we have in the whole entire course, and it's the last one. But you'll get at least a couple of these clients throughout your personal training careers, and I recommend when you do get someone who has one of these conditions, just do a quick refresher on some of the ACE material about the particular disease or special population that they're in, so you can adapt. You can always Google those medications that they're on, so you might have to refresh yourself with a lot of these. But as far as the ACE exam goes, they might have a couple of testimonials or case studies of questions about this pregnant person has this. A movement you should avoid should be this, that. It should be avoid supine movements. So just make sure you know what to avoid, and then really pay attention to the charts here, as that might be the most asked thing, would be what's on the charts for the frequency, intensity, duration, mode, and stuff. All right, please email me with any questions that you may have. And then I will be emailing you about the practical exam next week.